Hello, brother.
Hi.
We have Mrs. B. She's actually 24 years old. She has a BMI of 41 and presented with offensive vaginal discharge. Her infection screen, she says, has been negative. Understandably, for a very young woman, she's quite distressed with her symptoms. Do you think?
Did you say all her infection screens negative?
Yes.
Right, okay. It can be quite distressing for a 24-year-old woman to be seen as a big person, and she probably perceives herself as being smelly. There's two things. She thinks she's smelly, and the other thing is she knows she has a discharge. And she thinks it's the discharge that causes the smell. That's not uncommon. And I have seen this in a girl who actually benefited with simple things. Very often when the infection screen is negative, it's usually simple lifestyle changes that are required to completely, dramatically change the situation. She does need to see her doctor to make sure there's nothing wrong with her, like skin problems, like any other reason for her discharge that is due to a gynecological disease. However, in my experience, that is less common. What is more common is that if she loses weight, she'll feel a lot better. And in one particular woman I had, a slightly older woman of course, she benefited from taking Orlistat. She lost weight to a BMI of something like 38 from 39, and she was a lot better. Her skin cleared, her discharge improved, her body image improved. She was a different woman when she came to see me in 3 months' time. So it is something positive to focus on to lose weight. But that's not the whole story. Sometimes I find that these non-infective discharges is often in women who clean themselves too much. They use soap, and soap is a major culprit. Stop using soap in your bath. Try and use showers more. Try and stop using tight underwear. Try and wash yourself only with water. Make sure you don't wash inside. The inside of your vagina, inside of your nose and ears as well, do not need cleaned, and most people don't seem to understand that and over clean themselves. Also, one thing we often forget as women is that when we wash our hair with shampoo, that soap tends to stay close to the vulva and vagina, and we need to make sure, and it's even suggested that you try and wash your hair in a sink so that the soap doesn't stay close to the lower part of your body, causing the alkaline discharge, which leads to the smell. Other causes of alkaline change of pH would be simple intercourse, because semen is alkaline. Sometimes a reaction to condoms, but that is less common. Using condoms can actually help your discharge. During menstruation, your vaginal discharge becomes alkaline, so you may notice that your discharge becomes more smelly straight after, but that tends to sort itself in a few days once your hormone levels change back to a more estrogenic
So in essence, what you're saying is that discharge after periods can change in odor, but it's not a cause for concern.
Absolutely, absolutely. Periods come when we have a withdrawal of the estrogen hormone, and withdrawal of estrogen levels to a lower level in our natural cycle alters our pH. The blood of menstruation is alkaline, and that also alters the pH. So that changes the normal flora of the vagina, and that changes the bacterial milieu, that changes the smell and the discharge that you have. It is not usually noticed by the person sitting next to you in the bus or in the tram, but you are very conscious of it yourself.
So what sort of discharges should a woman be worried about?
The first thing to watch out is the discharge irritant or burning you? Is the discharge curdy, or do you note the need to actually keep wiping yourself so much that every time you wipe yourself it burns? Sometimes a discharge can make you burn whenever you pass urine, and if it burns when you wee, that is another thing to watch out. Sometimes you've had intercourse and your discharge starts burning in about 3 to 4 days time. That could be serious infections including trichomonas or gonorrhea. That is something to watch out for.
One of the concerns this patient or this person had was the fact that her GP has refused to do a cervical smear, and she's concerned it may be cancer. What do you think?
You said she was just 24.
Yes.
Cancer is extremely rare in women under 25, especially cervical cancer is extremely rare in women under 25. She probably thinks she's got the virus. Yes, you can have the virus. It's very common to have the virus associated with cervical cancer if you're under 25, but you also have your immune system dealing with the virus very well, and therefore you have the natural protection against cervical cancer. It is not impossible, but very, very unlikely that she has cancer.
Thank you very much, Dr. Prabha. It is my hope that people will continue to send their questions.
Hope it's useful.